you so much to everyone for joining us, for taking time, your evening, night for this workshop. So yeah, we're really excited about it, and we're honoured to have our specialist experts with us tonight as our guests. So I am Rachel, and I work for Move Charity as the resources officer. So this is one area of our work is the online resources, so that includes these workshops and things like that. I'm sure many of you know about our other areas of work, such as our 5K Your Way groups, which I know many of you are here because of that, as well as our Move online programme for young people living with and beyond cancer. So I'm sure many of you have heard about that before. So before we start, a bit of general housekeeping. We've kept you all on mute so that we don't get too much background noise. So if you stay on mute, that would be perfect for us, but of course you can have your camera on. We are recording it, but your faces won't be recorded. It will only record myself, Tom and Rebecca, and the screen that they're sharing. Sorry. And if you do have any questions that you'd like to ask Tom or Rebecca, then you can please put them in the chat box down below, and they'll take time to answer them towards the end. And if we don't have time to answer them today, we can follow those up in an email afterwards. Also, a quick disclaimer that all the advice given today is generic towards anyone dealing with cancer, living with or beyond cancer. It's not aimed towards any specific type of cancer or any specific treatment type. So please don't do anything that, well, please talk to your healthcare professional if you'd like to try any of these things. So without further ado, I think let's get started. I'll introduce the fantastic guests. So today we're presenting, we've got Tom Cowan, who is a exercise physiologist and cancer rehab specialist and has worked with us in Move before, and also Rebecca. So Rebecca is a consultant in sport and exercise medicine, an international athlete, and also one of our wonderful 5K Your Way ambassadors for the Sheffield group. Is that right?
Yeah, Endcliffe Park, yeah.
Nice. So I'll leave them to introduce themselves further, but other than that, I think I'll hand it over to you both.
Thank you, Rachel. I'm just going to share my screen now, so just bear with me 1 second. Rachel, please could you just authorize the screen sharing?
Oh no, what have I done here? Who can share? There we go.
Okay, can everyone now see the presentation?
Yep, you can see that.
Fantastic. Okay. Rebecca, I'll let you take over.
Okay. Thank you very much, Rachel, for the introduction, and thanks for the invite today. Really excited, and I expect that Tom and myself will be able to talk all evening about this, but we'll try not to. We'll try and talk for about 45 minutes and then answer some questions. What we're going to talk about is about exercise and generally being physically active, because the two aren't exclusive, and it's all about moving more during chemotherapy and why that could be something that's really helpful and how you can get about doing that. So in terms of the topics that we're going to cover, I think we've got a little bit of a list of those on the next slide, I think. And we're going to talk about, I'm just going to mention really briefly an overview of what chemotherapy is as a treatment, which many of you may well know about, but that's just to give us that framework so that when Tom comes to explain how the benefits of exercise start to work, that gives us something to refer to. What are the benefits of being physically active and exercise are during chemotherapy and how to do that? And also just some of the health and lifestyle considerations during chemotherapy, some things you might want to be mindful of, some things that we might see as barriers. Some of these things might spark up your own questions for later on, hopefully. And just some of the maybe other potential benefits that maybe you hadn't known about or thought about. And then we're going to also talk a little bit about after chemotherapy, kind of what comes next and where can you go. That could hopefully also be the next talk. So just briefly, I'm Rebecca, lovely introduction from Rachel, and I'm a consultant in sports and exercise medicine, which is a really eclectic medical field. So it's being a doctor, and it is everything from looking after people who want to go to an Olympics to people trying to get fit enough to have their treatment. And to be really honest, there's not much different between the two. There are goals in terms of treatment and where people want to get to, and there are fitness assessments that we can do and ways of helping people attain the level of physical fitness that they might need, and also enjoyment, and looking into the research about what it is about being more fit that is so good for us. I am an ambassador for 5K Your Way in Sheffield. It's an absolute privilege, that group, to be a part of, and it's a wonderful movement. So if you don't already have a 5K Your Way that you go to near you, they're the last Saturday of the month within Park Run, and yeah, go along, take a friend, you can walk half of it, take your dog, and it's a great part of the weekend for many of us. So I'm also working on something called Moving Medicine, which is a resource to try and help healthcare professionals, but also people who've had experience of cancer, to be more active, and that's got its own little website, movingmedicine.ac.uk, which hopefully is a link to, and that's a free resource to tell you more about how to get into physical activity. And my current roles are working with the English Institute of Sport, with GB Boxing, and also trying to work with the NHS toward getting exercise medicine to be a more fundamental part of what it does, but also working with Marylebone Health Group, which is a London-based clinic as well. And I'm going to let Tom introduce himself, because there's a lot to tell you about.
Hi everyone, thanks for having me this evening, Rachel, as well, and thank you for the invitation. I'm a clinical exercise physiologist. I work very closely with Rebecca at the Marylebone Health Group, previously known as CHHP, on Harley Street, and my role really is to devise exercise programs that are safe and effective for cancer patients at all stages of treatment, and all different types of cancers, different side effects taken into consideration, etc., which we'll delve into a little bit later in the presentation.
Thank you, Tom, and we'll come back to you really soon to talk about what this is all about in terms of exercise and cancer. I'm going to just really briefly talk about chemotherapy and what that is. So in its most basic terms, it is a treatment that kills cancer cells, basically tries to stop the growth cycle of those cells, which unfortunately can have other effects on the body because it's stopping that growth cycle of the tumor cell at a certain point. So that can be most evident when people look at things like hair loss, for example, because it's stopping that growth cycle at a certain point. But we'll look a little bit later about some of the considerations for what that means in terms of our bodies and some considerations around exercise. It's a widespread treatment, so it's systemic, so it's basically usually given intravenously and travels through the blood, so it will affect the whole body system. Usually we do have more targeted forms of chemotherapy and treatment types now, but it's still a mainstay of treatment, and often the first type of treatment that someone might have after their diagnosis, because it's got the most evidence base around it. It's what's been used for a lot of years now. Different cancers will need different types of treatment, and because different cancers are at different stages, again, the type of treatment will depend on that stage and on that cancer type. And that will also tell us what type of treatment is going to be given, what type of dose, and what side effects will happen. So really important to engage with the cancer therapy team. That's usually an oncologist and the clinical nurse specialist. But it's never too early to talk about exercise. I think it is the right time for everybody, and it's a lot to take on board during a cancer diagnosis. However, sometimes, or all the time really, being more active, even in little tiny ways, from like controlled breathing exercises through to more formal exercise, is something that can help the patient to take control of their cancer journey. So it's taking that away from being something that's being given to you. So in broad, we've mentioned that it's something that kills the tumor cells. That's what the aim is. Stops those rapidly dividing cancer cells that are out of control of a normal cell life. But again, because it does that, it can have an impact on other cells that divide fast in the body that are meant to do that, and it helps to lead to damage of DNA in the cancer cells, which helps to kill those, for those to die, which is called apoptosis. We're not tonight going to talk about things that aren't chemotherapy, so all the other treatments around cancer. We may come back and do a talk around those, I think, especially around immunotherapy now, since we last did the talk, which is it 2 years ago, Tom, I think?
Last year, Rebecca, I think.
Was it last year? Time, yeah, I think it's quite fast. But there's a lot more treatments around immunotherapy, which is a bit different. Hormone therapy in itself, radiotherapy, and obviously surgery. And they may be all types of people's journey. And I think what's important there is that sometimes we're talking for example, surgery plus chemo. Well, what does that mean next? If someone has a stoma and then they've got to have chemotherapy, but they want to exercise, and all of these things can be tailored together. And I think that's where it's really important to ask your team and an exercise professional for support. So very briefly, in terms of how the treatment is given, treatments are usually tailored over a period of 2 to 3 months. Again, it'll be individual for everybody. And the cycles are typically every 3 weeks, but it might vary from 2 to 6. And that's based on the cell life. So basically, we're trying to hit those cells at that dividing point and stop them in their tracks, but yet give the body time to recover. And this is important for us to remember for later on, when we're going to talk about how we can maybe periodize exercise and give the body more stimulus when it's being hit less hard by the chemotherapy, and a little bit of recovery in the times when it isn't. So that's just something to bear in mind. The number of doses will depend, I should say, on the type of cancer and medication types. Again, it will depend on the type of medication being given. It's usually an intravenous infusion, so that usually means like a cannula, a little needle, either in the arm or the hand. So one is a bit stuck to that machine and that infusion at the time. But again, when you're sitting there, can it be an opportunity for seated-based exercise? We'll come on to that as well. And it might not just be chemotherapy. So we need to bear in mind that there are some other medications that will come along. Anti-sickness medications are wonderful things and can really help someone to have a normal life, as normal as possible when they're having their treatment. And steroids are often given to reduce inflammation and reduce some of those side effects. However, steroids are interesting because they can give you a really good boost of false energy. So people talk about feeling like a Duracell bunny on a steroid, but it can have that short-lived effect and some counter effects. And then on the other side of a steroid, steroids do tend to not really help us. They're not like anabolic steroids like we talk about in sort of gym goers, that bodybuilders, that maybe should be going down a more natural route. But these type of steroids tend to unfortunately lead to muscle loss and bone mass loss, and they tend to like lead us to build a little bit more fatty tissue, so they don't help the body to be exercise ready. So we have to work against those a little bit, but usually they're used for a shorter amount of time as possible. So that's something around treatment. Onto the way more exciting bit now with Tom about the why of physical activity and exercise.
Thank you, Rebecca. So in this next section of the presentation, I'm going to discuss exactly the benefits of exercise and physical activity. Rebecca mentioned movement being key. So when we talk about exercise, we're talking about structured forms of physical activity. So that could be cardiovascular exercise, or it could be resistance exercise, it could be flexibility exercise. There's lots of different types of exercise that we might be referring to here. And physical activity is a bit more unstructured. It might be, for example, doing housework or gardening, or even just walking to the shops. Okay, each of them can have a benefit as you're going through chemotherapy. So in this initial part, I'm just going to talk about the why and the different benefits that might be able to be achieved through exercise and physical activity. So this is evidence that's been found in breast, colorectal and prostate cancer patients. Most of the research in exercise in cancer patients are in these three population groups. So what the study sort of found is that the risk reduction from all-cause and cancer-specific mortality could be reduced by being more active, more physically active. And this is against the 2018 physical activity recommendations, which were looking at exercising, doing moderate intensity aerobic exercise of about 150 minutes per week. Okay, so if you could achieve more than that, or around 150 minutes of moderate intensity aerobic exercise per week, then it was associated with this risk reduction of around about 40 to 50%. Okay, so I wanted to just bring up this slide really just to follow on from Rebecca's treatment presentation that she did at the start of the presentation, just to really show the whole spectrum of different side effects that different people might experience. And obviously some people may not experience all of them, they may experience some, they may experience none at all, but these are the varied side effects that someone might experience. Obviously today we're looking at chemotherapy, and as you can see, there's a whole host of different side effects we might be looking at. Fatigue is ticked, and you can see that's common to all of these different treatment types that are shown here, and it's something that I'm going to focus on a little bit later. Chemotherapy, as it shows, can have a whole host of different side effects, and exercise, thankfully, doesn't really have any negative side effects, but it could also maybe help to manage some of these side effects or combat them. Okay, so some of the side effects I pulled up here, and what you'll see is that there's a whole host of both physiological and psychological side effects that chemotherapy could have, or just cancer treatments generally could have for someone. There was a study, a really important one in 2018, which was an international roundtable study. So what they did is they looked at lots and lots of different papers and then summarized them. And the strongest evidence for exercise and physical activity was, or the evidence was strongest, I should say, in these different side effects that exercise might be able to help manage. So lymphedema, depression, and anxiety being obviously psychological side effects, health-related quality of life, that HR stands for, cancer-related fatigue, and physical function. So there was evidence for other benefits as well, such as improving sleep quality, and bone health was a sort of moderate strength evidence, but these ones shown in red are the ones that really showed the most, had the strongest evidence behind them. Okay, so I'm going to come on to cancer-related fatigue. This is the one of the most common side effects of different types of cancer treatments, and definitely the case in chemotherapy. We tend to find that fatigue can come and go in waves, so it's not always necessarily constant throughout treatment, and not even the same within the same cycle of treatment. You typically might find that the fatigues may be greatest in the days just following the dose of chemotherapy, perhaps once the steroid effect is worn off that Rebecca mentioned, and then towards the end of the chemotherapy cycle, as you come towards the next one, perhaps the energy levels are improving. And this might be something that we think about with the exercise prescription, as Rebecca sort of alluded to briefly earlier, of periodizing the training, where perhaps to start with, immediately or very closely following the dose of chemotherapy, we need a little bit of rest and recovery, and maybe some shorter, lighter intensity exercise, but then we can maybe start to pick up the intensity a bit, maybe go for some longer exercise sessions towards the next dose of chemotherapy. So maybe 2 or 3 weeks post that previous dose of chemotherapy. Anyway, cancer-related fatigue is, yeah, as I said, one of the most common side effects that you could experience through or from as a result of cancer treatments. It may seem a bit paradoxical to then think that exercise could improve fatigue, because surely if you're physically exerting yourself, you'd expect that that would tire you out even more. But actually a group in the US, in the States, called the National Comprehensive Cancer Network, they actually recommend exercise as being the #1 approach to combating fatigue. And this could be for a few reasons. Exercise, as I said, there's some evidence to show that walking could have a positive effect on sleep. And obviously if we can sleep better and we can improve that quality, then that should lead, you'd think, into improved energy levels. Exercise also, it can improve cardiovascular fitness, and it can improve muscle mass and body composition. Both of those may help you to perform what we call activities of daily living, or ADL, you may see in text if you're reading papers, etc. It'll allow us to do those a little bit easier. So perhaps maybe going to the shops takes less effort, or you know, going up and down a flight of stairs would take less effort, and therefore, as a result, we might experience less fatigue, and just be able to do more things during our day-to-day lives and experience less fatigue. What I should have said as well is that unfortunately, chemotherapy tends to cause a reduction in lots of different measures of physical function. So things like muscle mass, muscular strength, muscular endurance, cardiovascular fitness, these all tend to decline during chemotherapy. So really what we're using exercise to try and do is to combat that, and to try and hopefully maintain and preserve cardiovascular fitness, for example, and muscular strength and endurance. Okay, so what the 2018 roundtable found is that in order to try and combat cancer-related fatigue, what we need to ensure is that exercise is really at least moderate in intensity. So they suggested moderate to vigorous intensity would help to improve cancer-related fatigue, and that there wasn't really much evidence for low-intensity exercise improving cancer-related fatigue. I want to be really clear, though, that's not to say that exercise always has to be moderate and there's not going to be any benefits at all from doing low-intensity exercise. As I was saying, fatigue may be particularly pronounced maybe immediately following chemotherapy or shortly after, and that might be a time just to do some gentle movement and just walking to the shops at a really low, slow pace, or just going in the garden and potting around. It would still be physical activity, it's still movement, there's still benefits to be had, and it's not something that we should think, okay, well, if I can't do moderate intensity exercise, then there's no point in doing it at all. Okay, so that's really leads on to the next point of just saying about adapting the volume and intensity appropriately during the chemotherapy cycle. And very important, and it shouldn't be overlooked, rest is really important too. There may be days that you feel like doing absolutely nothing and just staying in bed. That's absolutely fine. If there's a day then that you feel a little bit better, you've got a bit more energy, the fatigue is reduced a bit, they're the days to maybe try and push a little bit more, see if you can reach that moderate level of intensity, and yeah, get out and be a bit more active if you can. Okay, so coming on to the one of the next sort of side effects that chemotherapy can lead to is, as I said, a reduction in muscular strength, muscular endurance, which we would refer to globally as this muscular dysfunction, which is very common amongst cancer patients generally, but also as a result of chemotherapy, and sarcopenia, which could happen. So sarcopenia just means a reduction in muscle mass. So what cancer-related fatigue may lead to, unfortunately, is inactivity, because if you're feeling tired, perhaps you don't feel like exercising. I've hopefully just given some of the benefits there to being active to try and combat the fatigue, but for some people they may just go into this unfortunate sort of downward spiral of inactivity, where that inactivity would lead to a reduction in muscle mass, this sarcopenia, and then it may feel even more of an effort to then be more active because you've got less muscle mass, you've become less fit. So what we're trying to do, obviously, is to promote exercise here to combat this muscular dysfunction and this sarcopenia, because these two things are associated, as you can see here on the screen, with greater prevalence of side effects and also an increased risk of mortality. So specifically resistance training, and resistance training we use interchangeably with with strength training, which really just refers to any type of exercise where you're lifting a weight or pushing a weight, pulling a weight, different things that different exercises that involve using a resistance. So that doesn't have to be going to a gym. It doesn't mean necessarily lifting heavy dumbbells, using machines. It could be simple exercises that you can do at home using body weight, things like press-ups, things like sit-ups. There's a whole host of different things. There's absolutely no need to use any equipment or to even go to a gym to be able to perform resistance training. And doing so could help to combat this muscular dysfunction, this sarcopenia. It can help to at least reduce that decline and try and maintain, but hopefully even develop your muscle mass and improve your body composition. And then that can have positive impacts on your metabolic rate. It can help you to maintain a healthy weight. So if you were potentially losing weight during chemotherapy, putting on muscle could help to improve your body composition and maintain that healthy weight. And improving the muscular strength and the endurance can also help in reducing falls and therefore reducing the risk of fracture, which particularly for patients with metastatic cancers, or if people have got osteopenia or osteoporosis, then that's a really important consideration. And just to come on to another, I'm not going through all the side effects, by the way, today, just going through a few that I've picked out. So cardiorespiratory health and fitness, as I said, another side effect of treatment and chemotherapy that we'd expect to decline, which is the side effect. Sorry. So the decline is sort of measured by what we call VO2, the VO2 peak declining. So VO2 stands for the volume of oxygen, and the VO2 peak is the maximum amount of oxygen that you can get into the body, transport around the body, and then utilize in the muscles. So that's really like our gold standard measure of cardiovascular fitness. And as it says here, this study in 2018 found that it typically declines during chemotherapy. And that's partly to do with the chemotherapy targeting the fast dividing cells, as Rebecca mentioned at the start. And some of those fast dividing cells are red blood cells. So red blood cells are a really important part of your cardiovascular sort of health and fitness, and the ability to transport oxygen through the body, because oxygen binds to a compound in the blood, in the red blood cell, called hemoglobin, and then is transported through the blood. So if the red blood cells are being targeted and hemoglobin is declining in the blood, then your oxygen carrying capacity unfortunately declines, which is why we maybe find it difficult to exercise, maybe feel fatigued, partly as well during chemotherapy. Chemotherapy can also have these other side effects on the body as well. So it can lead to this high variability in heart rate and in resting heart rate. So sometimes that can lead to a really high resting heart rate, something called resting tachycardia, which is where the heart rate goes above 100 beats per minute. And Rebecca will come on to this in a little bit, so I won't steal her thunder, but again, exercise needs to be adapted if that happens, or maybe even not done at all if it gets to a certain level. And then exercise, and then also, just to finish with the effects, then chemotherapy can also, certain types of chemotherapy agents, I should say, and specifically a group that we call anthracyclines, so things like doxorubicin, can lead sometimes to cardiotoxicity, which can lead to cardiac dysfunction. Okay, so just something to be aware of with that. So that can then unfortunately lead to an increased risk of cardiovascular disease and etc., which is where exercise can hopefully play a part as well in reducing that risk. So I'll just bring up this last bit on this slide. So what this study in 2012 found is that performing cardiovascular exercise can actually help to at least preserve cardiovascular fitness going through treatment, and that isn't as a result of increasing the number of red blood cells as the chemotherapy sort of caused to reduce. It's more to do with these adaptations in cardiac function, plasma volume, and then peripheral adaptations, which are more at the muscle in terms of more vascularization, so more blood vessels in the muscles, and changes in the mitochondria, which are what produce the energy for muscular contraction. So if they're the benefits, then really the important bit is how can we then put this into practice, and how can we exercise and be physically active? And I'm putting a big focus on both of those. I just don't want to just say exercise, because physical activity is also very, very, very key. So first question would be, when should we implement exercise? So this is just a time frame or a timeline during the different stages of treatment, something called the physical activity and cancer control framework. Firstly, we'll bring up the treatment slide. So if we're looking at exercise during treatment, which is what we are doing today, so this is the one I'm going to focus on, exercise has been shown in the study in 2018 that it can be completely safe during chemotherapy if it's prescribed correctly, and it should be encouraged because it can give these benefits I've already mentioned about the physical functioning, can be improved in this health-related quality of life as well. Hopefully, you would already be exercising before going into chemotherapy. But obviously, there's the benefits to be had during treatment, but there's also these benefits to be had before chemotherapy or treatment even begins. Okay, so following diagnosis, patients can already be experiencing fatigue, and I've already mentioned about the benefits that exercise can have in combating that. And there's also the benefits post-treatment. So after chemotherapy, it's really important to then continue with the good habits that you've been doing and keeping to, hopefully during chemotherapy and during treatment, because there can be an increased risk of cardiovascular disease in that survivorship phase, and exercise and cardiovascular exercise can help to maintain and help to improve cardiovascular fitness and health. And importantly, some side effects such as fatigue, there might be late effects that might come on actually after chemotherapy. So again, helping to manage and helping to combat those side effects is really important. Okay, so the next question would be how much exercise? Now, the World Health Organization give these guidelines. Now, these are the guidelines for sort of general health for the general population, and therefore there's no real different prescription for cancer patients. Okay, so these recommendations are at least 150 minutes per week of moderate intensity aerobic exercise, 2 to 3 strength or resistance training sessions a week, which target the major muscle groups in the body, and then doing flexibility exercises, which might be Tai Chi, it might be just doing stretching, static stretches or mobility exercises, or it might be yoga, different forms of exercises that have that flexibility element to them, and doing those on a frequent basis. But the 2018 roundtable study that I alluded to earlier took it a step further, and they started to look at some of those benefits that they found that I mentioned at the start of my talk, which was that mixture of psychological and physiological benefits. But they started to look and see, well, from the studies that we've looked at, what general prescription related to achieving those benefits. And what they found actually is that the benefits could be achieved by just doing moderate intensity aerobic exercise for about 30 minutes or more, at least 3 times a week. So that's quite a bit less than the 150 minutes that the World Health Organization guidelines have given. So that's good news. You maybe don't need to do quite as much exercise to achieve those benefits. And that was really key, was the moderate intensity aerobic training. But then they said that if you added resistance training on top, and with that prescription that I've just put below there, so that's doing it at least 2 times a week for at least 2 sets, so at least 2 rounds of each of the exercises, and doing each exercise for 8 to 15 repetitions. And the last bit means doing at least 60% of what we call your 1 repetition max. So the maximum amount of weight that you could use for an exercise that you could either push or lift or pull or whatever for 1 repetition. So doing at least 60% of that. And they found that adding that resistance training element actually just gave similar benefits to doing the moderate intensity aerobic training. But, and there is a but, resistance training will give different and specific benefits that moderate intensity training won't. So my recommendation would be if as long as it's appropriate for you, is to try and do a mixture of both of these within your exercise program, as well as the flexibility that the World Health Organization guidelines recommended as well. Okay, so how much exercise? Again, we've still talked quite generally. We've just talked about doing aerobic exercise and resistance training, and this 3 times 30 minutes, or at least 30 minutes. What this study also found is that exercise really should be prescribed, and it should be individualized and tailored to the individual. And that's because everyone's got different needs. And also, just to add a different layer of complexity to it, those needs might change throughout the treatment cycle. So that first week after chemotherapy, the needs might be very, very different for you to 3 weeks after treatment as you just come in towards the next cycle. And that might be because side effects have changed. The fatigue is not quite as pronounced as it was at the start of that cycle. And other side effects might be, coming into play as well, things like peripheral neuropathy or other side effects related to the chemotherapy. And we may also need to adjust this exercise volume and intensity for different people, because different people have different levels of fitness. Some people might be doing no exercise, so it might be a bit too much to suggest that they go and jump straight to doing 3 times 30 minutes a week. Actually, what's really important is that whatever amount of exercise that you're doing, that you just build up gradually towards those recommendations. Okay, and don't feel that you've got to jump from doing nothing to doing all of that 90 minutes per week of aerobic exercise. Good. And yeah, just again at the bottom, I've just put rest and recovery is important, because I just don't want that to be overlooked. It's really important to factor that into any exercise program for athletes, cancer patients, people who just want to lose weight, whoever they are, whatever their goals are, whatever their needs are. Super important point. Okay, so really what the take-home message is, and this sort of builds on what Rebecca was saying earlier, is that avoiding inactivity is the key. So we've got these guidelines of ideally how much exercise we want to achieve, which I was mentioning with the 3 times 30 minutes for aerobic exercise and 2 to 3 resistance training sessions a week. But when it comes down to it, avoiding inactivity is key. Obviously, there will be times and days that you do need to be inactive. If you have extreme fatigue in the days after chemotherapy, have it as a rest day, build that into the program as a rest day, do a little bit more and avoid that inactivity once you feel a bit better. So this means that physical activity, so unstructured exercise or just general movement, is really, really important. And that could be gardening, as I said, it could be going to the shops, it might be cleaning, it might be dancing, it could be playing with your children or your grandchildren. It could be a whole host of things, and try and pick something that you enjoy doing, and that will make you more likely to do it. Try and factor it in as well into your everyday life. If you can go shopping and maybe park in the car park that's furthest away from the door to the supermarket, that'll mean that you're getting a few extra steps in and just increasing that physical activity without it becoming a major thing that you've got to go out of your way to do. Okay, so lastly, really for me, I'm just going to come on to the different types of exercise, which I've already touched on. So I'm just going to skim through this fairly quickly. And what's really important is to try and get this whole host of different areas of exercise, or different types of exercise into your program. So we've got aerobic exercise, which might be running, it might be jogging, it might be brisk walking, it might be cycling, swimming, and some of these may or may not be appropriate for you. So I'm just talking again quite generally, as Rachel was saying, and always check with your doctor or your medical professional that it's suitable for you. Resistance training, that will give different benefits to the cardiovascular training, for example, developing the muscle mass or maintaining muscle mass, whereas aerobic training would help to improve cardiovascular fitness and perhaps reduce fat mass if you're looking to reduce weight, etc. And then there's flexibility exercises, which can have other benefits, such as possibly reducing joint pain, which is quite a common effect of cancer and of cancer treatments as well. So just going back to that 2018 study again, they showed that, and apologies, it's just a little bit blurred on the screen. They found that different types of exercise could have different benefits. So, for example, resistance training alone, only doing resistance training without doing any aerobic training, actually didn't cause any reduction in anxiety. It's just one example there. Okay, so just really hammering home the points of getting that balance and that mixture of different types of training in an exercise into your program. So just coming back to this statement again about tailoring and personalizing the exercise program for people, and that's where the help of an exercise professional or a cancer rehabilitation qualified instructor can help to make sure that the program suits your needs and is tailored to your specific considerations that need to be factored into your program. Can help. So this might be cancer related, so the cancer, the tumor type related exercise and modifications that need to be taken into account, or it might be treatment specific. So that might mean, for example, if you've had chemotherapy, one of the side effects may be peripheral neuropathy, which is damage to the nerves, which if that's in your hands, it might mean that actually gripping weights is maybe not the safest thing to do, maybe not the best thing to be doing. And a modification there might be to instead use exercise machines. If you drop the weight, it's okay because it's going to go back into the machine. It's not going to drop on your feet or cause you an injury. Fatigue, I've talked about already. Cytopenias, so that might be, for example, the reduction in white blood cells and the reduction in immune function that is a usual side effect of chemotherapy. If you do have a low white blood cell count, then you're then at a higher risk of infection. Going to the gym might not then be the safest thing, and sharing equipment with other people, even just going on public transport to get to the gym, might be exposing you to germs and putting you at risk. So actually to do a home-based exercise session in that case might be a better alternative, and using your own equipment that you can disinfect and perform in the safety of your own home might be a better option for that. Metastases, I've mentioned as well, maybe just reducing or limiting exercise that involve high impacts, such as jumping and bounding, because you're more at risk of that risk of fracture with the weaker bones, and actually performing like balance type training to try and improve stability and reduce the risk of falls could be a good prescription for someone with metastatic cancer. And then there's other types of considerations and modifications as well that might be needed for comorbidities. For example, if you've got high blood pressure, or anthracyclines I've mentioned with the effect that has on cardiovascular health. There's PICC lines, which the general recommendation for that would be to avoid anything that involves any exercises that involve vigorous arm movements. So lower body exercise could still be fine, and it might be more of a focus on the lower body exercises whilst the PICC line's in. Okay, and that's it from me. So I'm just going to pass it back to Rebecca there to follow on.
Thanks very much, Tom. As ever, a hard act to follow on these Zooms. We've had some absolutely brilliant questions as well, which I'm certainly going to make time for, distracting me, which is brilliant because they're important questions, but not from the important stuff that we've just heard, and in which Tom mentioned around exercise and heart rate. This slide is a little bit of kind of like thought process at the moment from new advice that's coming up. And actually sometimes when I'm at 5K your way, somebody will come up and say, do you know, my heart rate is all over the place and I've finished chemo or I'm during chemo, and it's really very interesting, but medically we have to consider, is this safe? Is this something different? So I think the bottom line is, if someone has what is it called a resting tachycardia, that means the heart rate is above or at or above 100 beats per minute. Now, some people have other conditions such as atrial fibrillation where the heart rate's not quite right. Now, that's a different thing. And if that's suspected, that needs to be brought under control, and people will have different exercise advice around that. But if it's going at its normal rhythm, but faster than we'd expect, we try and help that to get controlled. And there are medications that can be used there. But what we see in cancer treatment is it's more the fluctuation. So there might be a time the heart rate's low, but then it sits up at a higher rate. Is it safe? And on the other side, really slow heart rates. Again, check in with your oncologist, but also see if they can refer you for a cardiac, and the field of cardiac oncology is getting bigger and bigger. And if the heart rate is slow, again, there can be other reasons for that conduction of the heart to be slower. Some people who are very fit, actually, they have a heart rate sitting around 40 or 50, and that might be normal for you, even if you're going through cancer treatment. But if it's too low, you get symptoms sometimes of dizziness or feeling faint, and that's not sustainable when you go on to exercise. A really good piece of work that actually is in progress, not published right now, by Amy Kirkham and her group, is looking at heart rates, and they've got some lovely data that was actually on the talk, which I want to signpost people to because it's still out there. Can Rehab, another charity that do some great work, have done a talk between a specialist who's in Canada, I think it's Canada, Tom, not the States, and Anna Campbell in the UK, and they've talked about some of the areas here, and they show some of the graphs that are in print. That's why I'm directing you, because we haven't got the actual reference yet. But basically, bottom line appears to be there's lots of variation. Some people have these high heart rate fluctuations, and the good thing is that now we have heart rate monitors. A lot of people have them. We can look at what those are doing. I am going to pick up one of the questions, which I think is completely relevant. Are palpitations something to worry about? I think they are something to pick up on. Just going back to when I talked about atrial fibrillation. So if someone's got an irregular heartbeat, so it feels like it's going fast, but in a different rhythm, so not like regular or feeling really like it is at a higher rate, it's one to get checked out, to be honest. It might be part of the normal for a fast heart rate, but if it's new for you, it's always worth getting checked out to make sure that the heart is in that normal rhythm, because we know some of these drugs are a bit toxic to the heart and can make some of those changes happen, or someone might have got a different rhythm for another reason. But it's worth getting that checked out. But the good news is we can exercise within those parameters if we can control heart rate. So what we can do sometimes is periodize our exercise to try and set your heart rate monitor and set your exercise to work under those zones. If the heart's still working really hard, you are getting a workout. Your body's under quite a lot of stress when it's having the treatment. So what we sometimes want to do is tailor that exercise, and it might be your heart rate zone that you can tolerate while you're doing your normal exercise might feel like, oh goodness, I'm actually moving quite a bit slower here, but you are still moving. And for this phase, trying to adapt to the new normals for that period of your treatment can be very effective in terms of fitness, but also helping to keep you safe. We see similar things in terms of blood pressure fluctuations. Sometimes that can be quite extreme for people having treatments as well. So again, it's getting to know those with the new tech that we have in terms of these watches. They can do everything but, I think, monitor heart blood pressure at the moment, but you can get a home-based monitor and get an idea. But really, it's getting to know what those levels are for you. And actually, sometimes if those are a little bit different and the variability showing up as different, that can be something that actually you can adapt to. And there are parameters where it might not be normal for you, but it will be safe. And the top line of this slide is actually the bottom line, which is that if you haven't had those significant difficulties, but you still want to exercise and work with your heart rate, looking at something like your heart rate reserve is actually more efficient than looking at this heart rate max equation that we used to use. Now, I'm not going to go through that in a mathematical detail. Either have a look at it because that's the equation on it, or ask a fitness trainer, or ask us and we can explain it. But basically, it's working out from that what your heart rate reserve measure should be, and then you can work out your zones. You can program them then into your fitness tracker, and that can help you. The benefit there really is it can use your current fitness level. And I think sometimes for people going through chemotherapy or shortly afterwards, or sometimes in the medium term afterwards, set the goals that are for you right now at the time. It's not about, unfortunately, like where you were with your fitness before, but the good news is it's often not about where your fitness levels will get to soon or afterwards, but it's about being able to adapt to where you are at this time, and using these heart rate trackers and using your medical team can be really useful on that. So that's basically heart rates. And I think on the next slide, some other things to think about. Some of these sound really negative, and I think it's just putting it out there what people will experience. So we're not saying, oh no, all these things will happen, because what we're driving for is the fact that people do lose fitness during chemotherapy, and also we lose time. You know, if you have that nice consistency and continuity of training time, you're going to lose that if you are less active during that time. But what the wonderful news about being more physically active is, and has been for a long time, is only growing, is that we can help to counteract not just the fitness loss during the time or time lost to exercise, but also some of those adverse impacts of the chemotherapy, which, as we mentioned, can be on hormonal systems, on our metabolic, that's like our body's engine health, the things in the little cells that help to stop us getting an increased risk of heart disease, diabetes, for example, and in terms of our bone and muscle health. So all of these movements, even if it's the very littlest, can help to reverse that process, and in our long-term health that's going to matter. So we do know that some of the treatments will impact our hormone systems, and in some people that might lead to basically early menopause or andropause. I am not going to interrupt this hugely, but again, someone saying that the fittest era have been since diagnosis, and it really can happen. So thank you very much for saying that. That's really, really important. It can be a really good moment to change your health trajectory as well. So well done. Just going back to hormonal health. So basically this menopause or andropause. So basically we can be losing, especially in women, around that estrogen that's positive, especially in men around testosterone, and having a lot less of that can make people feel joint pain. It can impact fatigue levels significantly. We lose that protective effect of those hormones on the health of our blood vessels. It's going to happen in terms of aging anyway, but maybe it's temporary, but maybe it's a lot sooner than one would expect. We do seem to see some evidence. There was some great work, I think it was from Kerry Winterstone about 5-6 years ago, maybe a bit more. Don't quote me on that, it'll probably be in the references, but looking at the fact that we do see those impacts on bone health in the short term, but it does look from preliminary studies like after the first hit, that bone health can plateau, and that means that we are likely to be able to build on that bone health, or at least try and keep it close to where it was. But we do have to be mindful of some of those effects. Some of the impacts, such as joint pain, can be quite significant, and again, it's an individualized approach to trying to optimize those. If anyone had any previous risks, like a family history of osteoporosis, or personal history of bone stress fractures, or personal history of smoking, those might increase the risk to bone being a bit thinner. So again, we have to be careful when we're on a treatment that might reduce that bone health further. We might want to do something like get a bone scan and get some specific advice from exercise medicine or metabolic bone health to make your exercise prescription right for you. But that does mean we can, on an individual basis, alter some of the broader recommendations. So we do have to be careful, like Tom's mentioned, about loading the spine, for example, when we've got metastases in bone. But if we know what the bone health is, we know where the metastases are, we know the relative risk, we might get to a point, and we can just best do this individually, to say, actually, the benefits of you being more active in this particular way are going to outweigh your risk of a fracture in this place. It's a tough balance, but as a team, we can often get there. We've mentioned the differences around heart rate response. For some people, it might be good to have a deeper dive into heart health. So, for example, yeah, I've had some patients who actually weren't hugely physically active after the treatment, but in some occasions have gone on to be elite athletes, lifting huge weights, things that I would never dream of in a gym. And, like, actually, that means that they've likely undergone some good, healthy remodeling in their heart. But we know that some of these drugs are toxic to the heart and can accelerate cardiovascular disease. So in some cases, it can just be helpful to get a little bit of advice. So again, it might be a heart specialist who works in oncology to say, do we do any screening here? Do we need to do an echo scan? Do we, in fact, look a couple of years down the line when you're lifting all the things and going back to running and just saying, yeah, your heart health is good, proceed. So I think some of those things can be helpful to us, just to give us a bit more of a green light that we were doing the right thing, and we can go further. I'm taking the next little bit from some great new research, and again, some of that was discussed in that conversation with Kristen Campbell and Anna Campbell in a recent webinar. So what some of the things that may be useful, and we've talked about this before for a while, is periodizing exercise around treatment cycles. I alluded to that a little bit before. So basically, before you're having your cycle that first week, your body's hopefully up to scratch with the immune system. You'll have had blood tests and you'll get some reassurance that way. Again, if you're carrying anything like a minor, even a cold, don't push it, because we want to get you back up to speed to get that chemo treatment. That's most important. However, if everything's good and you're stable around your chemo, that can be a good week to do a little more in terms of exercise. And it might be that you can actually continue during your treatment. There are some other things down there in the barriers, like just looking at how much of your day it's taking to get to travel, appointments, but can you sneak in some exercise in a way that isn't adding to the burden of everything you've got to do? For example, could you be doing some seated exercise while you're having your infusion? Small studies, but they do seem to report greater tolerance to chemotherapy, less side effects. Again, we need more science to show that this is the case, but if it is, and it helps someone get through those boring hours, another study did actually give the qualitative report that it reduced the boredom, which is also great, but it might give you a window to exercise. And then looking at the last part of that periodization, maybe doing a little bit less in that tired week after your chemotherapy, because we've got the exercise there, your body will still retain that fitness and adapt, but we can then recover. A big take home that came back from Amy Kirkham's group was adjusting for these bad days. As Tom said, if you're floored with fatigue, don't push yourself through. It's exactly the same with elite athletes. But the interesting work, and this comes back to some work from I think it was Mustian probably about 4 or 5 years ago as well now, but saying, actually, if you're tired but not exhausted, still turn up, but we will have a bad day card in terms of slow it down, do what you feel, and then we can ramp things up again rather than feeling like you're losing even more time. We know, as I say, there are barriers, and treatment-related symptoms are important. We'll come a little more into some of those questions that are hard to answer around things like PICC lines, but we'll usually find a way. So there are the things that we say, oh, don't do them because we're cautious, but really what we should say is, this is what we know. Come individually to the specialist. We will ask the questions, we will see, because people do extraordinary things and more things. And if we can make those as safe as possible for you, and we can learn that that actually helps you, let's talk about it. And yeah, again, the take home bottom line, a nice paper from Thomas a couple of years back now, is that we do seem to see greater adherence, and that means more treatment dose getting to people, and hopefully better effects from that. I think, Tom, am I going to talk through this one as well, which, yeah, that's absolutely fine. In terms of when not to exercise, yes, there is a time not to. And if you've got a really high temperature, obviously we've all got really used to taking temperatures over the past couple of years. So 100 degrees Fahrenheit, I think that's about 39, 38. I think, if we're thinking anything that's over sort of 38, correct me people if I'm wrong, but not to exercise then. If there's vomiting or sickness that's really not controlled, and obviously diarrhea can be an issue. Some of those might be issues that you're struggling with through your treatment. If it's a new thing and we think it's an infection, that's when to stop. I mentioned before, the time to really seek help from a medic, from your team, call up the CNS if that blood pressure has gone really high. And we've measured that over a period of time. So we want 2 measurements like 5 minutes apart, and we want to do that, make sure someone's rested. And the same with heart rate. If it's up there over 120 and it's 2 measurements 5 minutes apart, really want to check in with why that is. And again, if you've got really low platelets, that's a basic score not to be as active. But again, depending on your diagnosis, what's normal for you, what your docs have agreed with, and if neither of you sure, we can kind of get a team together, often with specialists in hematology and exercise medicine, and say, well, actually, here's what we can do, or sometimes how we can compromise to get active. The next bit is more fun. The good news is that things like 5K Your Way exists to help us when we know that exercising with friends, family, or a group may seriously motivate you. There is proper evidence to show this. There's a couple of brilliant studies, Respect and Renew, both from 2020. Ironically, both published at the time when we couldn't do exercise with other people. I think everyone experienced like how much harder that was. The move to doing some online sessions. I know that Tom did one of those, or more probably than one of those. Was really, really helpful. But just being with somebody or having someone to pair up with, and the 5K Your Way group, it can just help that motivation. I think it can also really help those around you. So family and friends who, you know, they might be helping you, but less likely in terms of the delivery of your medications. But this is something that will make you both feel good. And you know what? You'll get to improve their health as well. But there's some lovely work that shows how exercising with somebody has an impact on quality of life, on physical function, and even on reducing anxiety, which is really important in terms of our mental health. And interestingly, prior to lockdowns, we talked about exercise with other people and with a supervisor, like in the room, being the most potent form of being physically active. But we learned a lot during lockdowns and the enforced remote sessions. These had already been delivered in some areas where healthcare is more remote, especially in the States. But the amount of studies coming there seems to say, well, actually, maybe we underestimated what exercise at home on our own can do. But if we link into someone either online, or we've got someone providing a group session and we're all in our own homes, it can still be really valid way of being more active. Changing topic a little bit on the last of my slides here. Well, I've got a couple more before we almost get to the end, and we hopefully have time for those questions. Nutrition for health and exercise. Again, this could be a whole other talk, and I'm not going to try to cover everything. Exercise and cancer is really difficult for our metabolic health and weight. What I mean by that is some people, often around the diagnosis, will have lost quite a bit of weight. Maybe before their diagnosis. It's especially problematic in the GI, gastrointestinal cancers, the upper gastrointestinal cancers, where just trying to sometimes get the fuel on board in a normal way is tricky. Some people with bowel cancers, for example, where they've had surgery, that can be difficult too. So what can happen is we can lose quite a lot of muscle mass at the beginning. So is weight important? Yeah, it's something that your team will clock when you go in, and they'll weigh you and measure you. However, longer term, your actual weight isn't going to be as important as your body composition. And cancer is hugely unfair in lots of ways. And one of the issues around cancer itself, when it's driving fast, is that it will break down our muscle tissue. And then along come these treatments, and some of them brilliant, but especially along with steroids, some of those can help with appetite and weight gain. But guess what? It's more likely to be the adipose fatty tissue, and muscle tissue doesn't rebuild on its own. And it's a very interesting one, because we have medications that can help us burn fat, and we have medications that can help us build bone, but we don't really have any that can help us build muscle. We have good old protein and we have exercise. So it can be really hard, especially at first, to rebuild. And it can be a bit disheartening if you feel that muscle loss. But as we've talked about around the whole of the areas around fitness here, it can be done. And that's why it's super important that we include forms of resistance exercise. And when we're weak, that can be body weight. So for example, doing some yoga, Pilates, just kind of using our own body weight, that can really help stimulate. And when we get to a place where we're a bit stronger, keeping that going, but building up that exercise resistance training can be really, really helpful. We want to make sure that we treat ourselves absolutely like an athlete at this point. Yeah, have the cakes. It's an important part of life. And even people that, I mean, there is some evidence for some people around a specific way of nutrition. Healthy nutrition is really important, but I think having some treats, we need to maintain that quality of life. But getting in that healthy balance, good proteins and the good building blocks, some of those extra things like not necessarily supplements, but if we're getting good levels of things like magnesium, for example, through our diet, and we're getting a good range of foods. If we're struggling, for example, with swallowing or with appetite, trying to get some dietetic support and sometimes getting some supplements in. You know, your elite athletes will get a protein drink after their training. So if you can take on board either a tuna sandwich or a protein drink or some other parallel way of getting that nutrition in, it can really, really support getting to build that muscle mass back, banking the sessions that you've done and building up from them. Again, in terms of bone health, the accurate dose of exercise plus good nutrition, good amounts of calcium, and some of those nutrients, the micronutrients around that, can really help us to build up bone health. And if we're physically active, we can start to reduce that body fat. If someone's body fat is actually quite high, it's good to reduce because it's an inflammatory thing, is fat. Some of it's really useful. It does support our vital organs, good fat, but some of that sort of the less supportive fat, like the low density cholesterols, can be a burden on our bodies and can increase that inflammation. So helping to reduce that, but all as part of that process, can really help us to drive health forward. But it is a tricky area. It's hard to do without cancer. So it is one to try and get that support. Be kind to your body and be patient. I think the final slide is, that's our group at Endcliffe, I think, down there. Exercise and well-being in trying to keep motivation. Again, like saying, being patient around exercise and nutrition, exercise can totally increase well-being and our physical health as well. It's brilliant for our mental health, but it's totally normal to have motivation alter. So for someone totally healthy, it's easy to have those days when we're just tired or we don't want to go out the door, or other things in life are taking precedent. Take those days and accept that they will happen. Sometimes they're kind of good days because they force us to stop, and the next day we remember why we did it. But look at the things that motivate you. Is it a family member, a partner, a dog, just the place that you like to go to exercise, the group that you like to be with? Even write those down. Think about what it is about exercise or physical activity. If it's the garden, if it's a certain path, if it's even doing the ironing, the housework, it might be that thing for you that just helps. It's unlikely the ironing, but some people do enjoy that. And remember to rest. Again, being kind to yourself, seeing as this is part of the process, part of a bigger picture, is really important. And trying to, you know, think of even of these like SMART goals and time and targeted related goals of where you want to be in a week, rather than thinking, I think it's important to think where you want to be in the medium or longer term if you can, but just breaking down where you want to be on Saturday. If it's not park run, what you're going to do that week. And finally, some of the good links that we've got for that, you might find some help in these. Move Against Cancer is a brilliant charity, and look at their websites. Moving Medicine, hopefully we've got lots of those support areas on there as well. And looking, I think that's Macmillan's website too. So there's lots of areas around, but if in any doubt, ask. And that's absolutely all that I'm going to say. Hopefully we've still got some time for you to ask some questions. Thank you very much. Links to our resources, contact us too.
That's great. Thank you both so much. Yeah, if we do have time for questions, for you guys to answer some questions, that would be amazing. We've had a lot through. I'm sure you've been keeping up with them. So maybe we won't answer all of them right now, but we can have a look at a couple. So someone said we'll be able to access the slides after the presentation. This is going to be put up on YouTube, so you'll be able to see the slides there afterwards. Yeah.
I'm going to grab Joe Taylor's, if that's okay, and then go over to Tom. Next one. Measuring muscle mass. Joe, fascinating and really important. I think sometimes looking at functional strength might be more important than the mass per se, but it's definitely a gap in research. There's some good work out there, but there's a lot more to be done. I think it could be a good way. There are some fancy things now in sports and exercise medicine world to look at how exactly we quantify that and strength. If you're trying to get an elite athlete back, for example, from a hamstring surgery, there are very specific things before we let someone sprint. So again, I agree. Could it be? I think it could be very motivational to say, well, look, muscle strength is here right now. Does that mean that actually if you're wanting to go for that run, maybe we need to get it to here? And looking at how we build it. But I think maybe quantifying that and looking at how that helped with falls reduction, with ability to get out of a chair, all the important things that help to keep us healthy and independent and also feeling good, has got a long way to go. But yeah, giving me a lot of food for thought. Tom, your question next.
Yeah, from Bridget. Good, Tom, please. Yeah, I typically, if someone has a PICC line, then I will just avoid anything really vigorous, anything that is vigorous movement for the upper body. So really sticking to lower body and core exercises where possible. Rebecca, I don't know if you want to touch on sort of PICC lines and swimming and.
Yeah, I mean, people have done inventive things with lots of waterproofing and support around it. And again, if it's absolutely your passion, it's a case of trying to work out what might be possible. We were hoping, or I think there is some work going on around trying to get a bit of a consensus around this. But I think at the moment, it's a very individual one, and it might be, you know, in lockdown, some of the elite athlete swimmers were doing like land-based swimming. Doesn't sound tremendously exciting, but just anything to keep up that technique and the breathing and that side. But again, talk to your team, send your actual issue to us, and we'll talk with Move and the brilliant people behind it and see what we can answer. But I think in that point, and in Sonia's too, like swimming can be excellent. Talked a bit, I think Tom, you mentioned, like, you know, the risks of infection, and they are there, and we've got to be careful, just like we had to be super careful around COVID and the lockdowns. But what if we look at, for example, if hopefully we are physically active, we could actually improve our immune system, and that risk might be lesser than sitting at home, deconditioning and worsening our immune system. So, for example, you know, some of the standards around swimming pools were excellent, maybe some places less so, but if you've got somewhere, you know, where the environment is really clean, and maybe you avoid going when it's like packed with kids and the changing rooms are all busy, but it's a really good physical activity. So doing something like that, trying to maintain it, can be really important. And again, it's finding what you enjoy. And just finally on that question from Sonia, you did ask about training with lymphedema. That was one of the game changers, changed the guidelines from the American College of Sports Medicine way back in 2010, because people were told not to exercise. But with lymphedema, getting the range of movement back, getting a good garment to support your arm, like a compression sleeve so it's right fitted, and getting into exercise, you can then usually build up with weights eventually, like in the affected limb, and it can help the drainage of the lymphedema, reduce the lymphedema, which is then going to reduce the risk of things like infections in the arm and debility. So yeah, it is possible, but get it a graded plan and work with an exercise professional on it.
I've got a question from Caitlin, which is a good one, on what constitutes moderate intensity exercise, which is a great question. There's lots of different ways that you can measure exercise intensity and whether it's moderate or not. So typically moderate intensity exercise is exercise if you imagine doing it with someone else, or even better, if you're doing exercise with someone else, if you could still maintain a conversation without sort of gasping for breath between too few words, then that would really be what would class as moderate intensity exercise. That's a simple test that you can do called a talk test. If you were gasping for breath between every word, then obviously that would be quite intense and more in the vigorous intensity rather than moderate. That's a very simple test. There's also heart rate monitoring. So as Rebecca mentioned, if you've got a smartwatch, if you've got which could be an Apple Watch, if you've got a fitness monitor, an activity tracker, a lot of those have got built-in heart rate monitors now. And there's different ways, not to be making it too complicated, but there's different ways that you can work out if you're working in a moderate intensity heart rate zone. And that could be using Rebecca's formula that she puts in there, which is looking at heart rate reserve. And there's certain percentages of heart rate reserve that you should look to work out to be in a moderate intensity zone. Or you could look at percentage of a heart rate max. So you can predict what your maximum heart rate would be if you're not doing a test to exhaustion. Sometimes you can do an exercise test to exhaustion, or a maximal exercise test that can work out your maximum heart rate, and then you can work out a percentage of that would fall in your moderate category. But there's different ways to use heart rate. One of the more simple tools is called rating of perceived exertion, or you might see it as RPE, which is quite a common method to use. And RPE is really just a fancy term of asking the question to yourself of how difficult are you finding the exercise. And it's normally either a 0 to 10 scale, where 0 is rest and 10 is maximal exertion, and moderate falls at about 3, or it's a 6 to 20 scale, which is being devised by a guy called Borg. So it's sometimes referred to as the Borg scale of RPE. And 6 is the lowest, because what the idea with the scale is that typically you times the number on the scale by 10, and it would be roughly what most people's heart rate would be. So most people have a heart rate somewhere maybe around about 60 as a rest, but obviously it completely depends from person to person. And maximal on the scale is 20, or times that by 10, and it could go up to 200, which again is a bit of a round number, because people could have maximum heart rates that hugely vary. So anyway, that's sort of a little bit of an aside. But the 6 to 20 scale, I think somewhat hard on the scale is about 13, so moderate would fall just underneath that. But I tend to use the 1 to 10 or the 0 to 10 scale, because it's a bit of an easier one to work with. And 3 on that, 3 out of 10 would be a moderate intensity. But yeah, it's something that you feel as though you could keep going for a fair amount of time if you're doing the activity, if you're doing the exercise, and you should be able to maintain a conversation at a moderate intensity.
Some brilliant questions on here. I'm just looking here. I'm going to try and answer like 2 answers. Great answer, thank you, Tom. What we did last time, I think we had loads of really good questions, and I think that actually piqued the interest in trying to get the PICC line specific answer, which we'll still try and do, but hopefully we answered more of the other questions. So we might try and collate them and put them on a place on the website. But Jessica, yeah, totally look for an exercise professional who knows about cancer. We have one on here, Tom is that, and does brilliant personal training that's just massively motivational. And I love sending patients to him. I never see them again, which is great, or occasionally we'll pick up, but they go off and do great things. But basically, Tom, you did Can Rehab, didn't you, as a course?
Yeah, I've done cancer education.
Yeah. Which is a brilliant standard to have. But again, it's just, and Tom, I know you do lots of remote stuff, so that's great, because hopefully we've got people from all over the country here too. And just on Willow's question, I love your comment, Willow, that you're fairly fit, used to be an international rugby player. So yeah, amazing. But in terms of, post-surgery, pre-chemo, jumping back into physical activity, I think if I had to be pushed to say do it or don't do it, it'd be like, do it. But let's do it with some advice around it, so that you don't go into something that's a little bit too much or, too hard, but helps to get you where you're at and build up. So if you can see an instructor and explain to them and they can support you, that's one thing. If they don't quite know enough, again, maybe see someone who can do that personal advice around where you're at in terms of your fitness, give you that reassurance, give you that to hold on to, and either you go back into the class or you want to do that on, like your bike yourself. It might be one thing, but it might be you can go to the class but armed with, here's what I want to do, and the intensity that I want to be able to do it at and sustain it. So, and then maybe looking broader at your program and your goals. And I'm just going to see if I can look back to your actual question. But basically, yes, seeing what is right for you. And it might be that then you periodize things like your aerobic cycle training and when you want to do strength. And if you're going to have chemo, we might say, well, maybe we can sustain muscle mass right then, but then maybe afterwards, when things like how that changes, body composition changes, we can start to build up what we get from the goals from the resistance. And again, like we've talked about with things like lymphedema, how exactly we're exercising keep things like Pilates, yoga in mind, so you can get that balance and make sure that you're really aware from how your body feels, like what the one arm with the lymphedema feels like compared to the other side, and making sure that you've got that underlying health, and then you can layer on those goals just like anyone else, but the timescale is just your own. And yeah, it has to accommodate for your treatment, but it can still be a goal that is yours, separate to that cancer and treatment.
There's a question. Oh, sorry, Rebecca, were you?
I was only going to check with Rachel that we could keep going and answering, because I'm happy to, but carry on.
I was going to say maybe 1 or 2 more questions, and then we'll probably have to finish up.
Yeah, there's a question from Julie just about advice on exercise for immunotherapy, radiotherapy, and hormone treatments. There's obviously, we've focused on chemotherapy today. There are specific considerations as well to bear in mind for the different treatments mentioned there. So radiotherapy, for example, one of the common side effects, one of the side effects from that is skin irritation. So clothing might be a consideration, maybe not wearing clothing that could irritate the skin irritation that you've already got from the radiotherapy. Again, swimming, chlorine. Rebecca, correct me if I'm wrong here, but a potential issue possibly for a skin irritation with that. Obviously, cancer-related fatigue is, as I had in that slide earlier in the presentation, that's quite a common side effect to each of those treatments. And then hormone treatments they're varied, but you can get types of hormone treatments such as androgen deprivation therapy, so ADT, which is where the actions of testosterone are either blocked or testosterone levels in the body are reduced. And testosterone is a massive stimulant, I guess, for developing muscle and maintaining muscle. So there are studies that have shown that that doing resistance training can still help to maintain strength and develop strength in people who are on ADT, and that might be more neuromuscular benefits that can be achieved. So there will be specific modifications that you might need to make when it comes to the exercises, but that might be something, Julie, that you and I maybe could discuss from here, so I could keep talking, I think, on that one, and we would probably go on and on.
Yeah, and on that point, all these questions have given us great inspiration for future workshops that we need to do. You know, as Tom said, today we focused on chemotherapy, but in the future we could definitely focus on some radiotherapy, hormone treatments, different side effects that haven't been discussed today or discussed in detail. I've seen a lot of people asking about PICC lines, central lines, so we'll definitely be looking to create some more resources around those. But yeah, I think we're pretty much out of time today. So thank you everyone for your